presentation on sex education by Mandy Beard, Marlon McCarty, Carrie Neely, and Laura Partain. Sex is a natural part of life, and whether people are educated or not, it will most likely happen. Sex education is one of the most important things parents can teach their children, and like it or not, sex education is important to start young, and most people think it should start with teenagers, but really it should start around preschool age. Children are in preschool from 3 to 5 years of age, and they may start to ask, where do babies come from? And always remember, answer honestly. Parents should also start to ask their children, what do they know about these questions that they're starting to ask? Now on to school age kids. And they're going to start asking more questions. And of course, who do they go to ask? Their peers. Well, and on to asking their peers, they're going to get incorrect information. And this is where the parents need to step in so they can get where they can get their correct information from their parents. And the parents can create a comfortable environment by starting young. That way the kids aren't embarrassed to ask questions. And sex education is very important for someone in their teenage years. Many teens are struggling with their body and understanding the changes that are happening. Teens need to be informed about the effects of having sex and multiple partners, sexuality, puberty, and body changes. And just as in the younger years, parents who talk to their kids and have an open line of communication are more likely to get more information from their kids and have a more comfortable environment. So it's very important to have an open line of communication with your children from parent to child. The reproductive system is made up of many sex organs that work together to make sexual reproduction possible. The female reproductive system is made up of the vagina, uterus or womb, fallopian tubes, cervix, and ovaries. The male reproductive system is made up of the penis, testicle, scrotum, urethra, vas deferens, seminal vesicle, and prostate gland. Conception is when an egg from a female and sperm from a male unite to make one and will develop into a baby, which occur commonly from unsafe sex. Without consent, sexual activity, oral, genital touching, and vaginal or anal penetration is sexual assault or rape. Consent is reversible, and someone can change their mind after something has started or before it has started. So, whatever you think, consent is reversible. Sexual abstinence is a choice not to participate in sexual intercourse of any kind. This method is 100% effective in preventing pregnancy and infection as long as sexual contact is avoided, including vaginal, oral, or anal sex. There is also other benefits of abstinence, including waiting until they feel like they are ready for a sexual relationship, waiting to find the right partner, focusing on school, jobs, and other hobbies. Safe sex is sexual contact that doesn't include the exchange of semen, vaginal fluids, or blood between partners. Safe sex is having sexual contact while protecting yourself and your sexual partner from sexually transmitted diseases and infections. It is also a way to be protected from unplanned pregnancies. Safe sex is about taking precautions in unintended pregnancies and in sexually transmitted diseases. Practicing safe sex is very important in preventing an unwanted pregnancy and possibly life-threatening sexually transmitted diseases. There are about 15 different contraceptives. The pill, condoms for male and females, IUDs, and other different types. All have different effectiveness in different ways. Some other different contraceptives are spermicide, contraceptive sponge, contraceptive injections, and vaginal ring, and there are some others as well. The most common type of contraceptive is the birth control pill. There are 3 types: the combination pill, progesterone-only pill, and the extended cycle. The combination pill is a combination of estrogen and progesterone. The progesterone-only pill is only progesterone, and the extended cycle is also a combination of estrogen and progesterone. When taken correctly, it is about 99.9% effective. The other most common type of contraceptive is the condom. They are male and female. For the male, it slides over the penis, and for the female, it is internal and it is inserted into the vagina. You do not use them at the same time because they can stick together and the other one can pull one off or they can tear each other. They are not 100% effective in the protection against STDs or STIs. So always protect yourself and be careful to watch out. So always ask partners about their history. The next kind of contraceptive we're going to talk about is an IUD, and there's a few different types. It's either hormonal or non-hormonal, and depending on the type, it either thickens the mucus, which prevents the sperm from traveling to the egg, or it can act as a spermicide and kills the sperm completely, or it's kind of like progesterone in the pill and prevents the sperm from fertilizing the egg. Women can also get an implant placed in their arm, and it can last up to 4 years, and it prevents the ovaries from releasing eggs, and it is also known as an Nexplanon shot. Next, we have the transdermal patch, which is a thin beige patch that you replace once a week, and you wear for 3 weeks, and then you leave off for 1 week. And it just acts as another contraceptive for women, and seen in the picture, you have 4 different places you can wear it. HIV is called human immunodeficiency virus, and it destroys white blood cells that fight infection. It affects about 1.1 million people in the United States, and it can be transmitted through having vaginal or anal sex, sharing needles or syringes, piercings, tattoos that have HIV-infected blood on them. STD. What is it and what does it mean? Sexually transmitted disease, also known as an STD, is an infection transmitted through a sexual contact caused by bacteria, viruses, or parasites. Most STDs affect men and women, but in most cases, the health problems can be more severe in women. There are many types of STDs, but the most common are chlamydia and gonorrhea. The most common STD is chlamydia, most common in women, but appears with no symptoms. If any, some may be genital pain or discharge from the vagina or penis. Antibiotic therapy is recommended for the affected patient and their sexual partner. Gonorrhea is the second most common, and it's a little more serious because if left untreated, it can cause infertility, and it's caused by bacteria. Some symptoms may include painful urination, abnormal discharge from the vagina or penis, and men can experience testicular pain, and women can experience pain in the lower belly. Gonorrhea can be treated with antibiotics such as doxycycline, azithromycin, and a few others. This concludes our presentation on sex education, and remember to stay safe out there and visit a local health department for birth control, STD testing, and many other services.